us outdoors types who spend a whole lot of time in the sunshine, we need to start thinking about some things regardless of what age we are. When I was 20, nothing could touch me. Dr. De Castro, my personal doctor who I talk to on
Nice
occasion.
to see you again, that's right.
I'm coming in, hey, what's this? We're talking about potential skin cancers today, a growing problem in the United States and all over the world.
Yeah.
What do we need to actively look for, and at what point do we need to come in?
If you have a history of several blistering sunburns, all right, if you have a family history of skin cancer, or if you have a lot of freckles or moles, those characteristics put you at a higher risk of having skin cancer. But then, of course, if you have a lesion, a specific lesion that you or your spouse might notice, that's something that we'd want to see too.
Now, you need to check yourself out.
Absolutely.
A full-size mirror would be nice, or your spouse, like you say, constantly be on the lookout for what?
Well, about once a month you want to look at your own skin, all right, and you want to look for anything that just really doesn't look right.
A couple years ago, I started thinking, ooh, what's that? And I did notice a spot that would not go away, and it would occasionally itch a little bit, then start to bleed.
Right.
I came to you and you said, hey, you've got a basal cell.
Basal cell carcinoma is the most common cancer humans get, and certainly the most common skin cancer. And the chance of it going in and really metastasizing is very, very low. So I don't want to mislead people into thinking that's going to affect their lifespan. But they can get very big, they can get quite ugly, and they can bleed, they can become quite a problem if you let them go.
This, on the other hand, is something you really need to have looked at. This is the worst kind.
Melanoma is a very, very, very bad cancer. It responds to very few, if any, chemotherapy. So the treatment of choice is to make sure, if you have it, to have it cut out early and get it all out. Because if you get it early, it's curable. If you let it go, there's very little that can be done. So what you're looking for is a mole that is growing or changing. Tends to be bigger than a pencil eraser, so larger than 6 millimeters, so a little bit larger than the typical mole. And it tends to have more than one color, so a very even brown mole that is very small tends to be nothing. But if it's a little bit of a larger lesion, maybe a browns and a tan or a white and a brown, something like this, so 2 or 3 different colors in the same lesion, that's the sort of thing that we really want to look at.
Hopefully the sun's not going to stop shining.
No. No.
But there are things, and you told me today that
It's a great shirt.
It's a good shirt.
It's a good shirt.
Why is it a good shirt?
Well, it's sun protective clothing, and that's actually a new technology that is really fantastic. Over the past 5 to 10 years, it's really taken leaps and bounds. My children and I actually too in the pool will wear a swim shirt, and those are designed to get wet. They're designed to dry quickly. They're designed to block the sun.
Now let's talk about products that we can use. Let's talk about, there's so many products. If you go to the store and look at what do you recommend? I mean, just as somebody knows they're going to be out there on the water.
Good. I want you to be out there. You don't want to be a hermit. You want to go hunt and fish and whatever you want to do. But what you want to do is just use some common sense. For example, the shirt is a perfect example. That'll protect you all day on the shoulders, the neck. You're going to be protected. Then you're going to end up, you want to also put on a waterproof sunscreen. And the biggest complaint I get about sunscreen is that it gets in your eyes. So if you keep a hat on, which you should also be wearing, because the hat's going to cover your ears, a brimmed hat, not a cap. If you get that on there, you're going to protect your forehead, your ears, your neck, etc. The other thing is you got to put it on about 30 minutes before you go outside. It's got to soak in. And the last thing I tell people is got to be a big sticky mess, a lot different from what people are used to. The spray sunscreen has got a lot of marketing, it's wonderful, but a simple spray like a perfume is not going to give you the 15 or the 30 that they're marketing. They're going to give you a 2 or a 3 or a 4.
We know we need vitamin D, but that doesn't mean we have to go soak up the sun for 8 hours a day.
Really, for vitamin D levels, it really only takes several 10 to 15 minutes, 2 to 3 times a week to get vitamin D levels. So tanning to excess for vitamin D purposes is not really indicated. Don't be a hermit. Get out there, have fun, get out in the sun, but use some common sense. Wear a shirt, wear a hat, wear some sunscreen, reapply the sunscreen. Try to just use some common sense as far as that goes. And then, of course, if you notice anything on your skin that you're worried about, please give us a call. Give a dermatologist, your doctor, anybody a call just to at least look at it.
Oh, look, this place right here. I'm just kidding.